Welcome to the third segment of our interview with Dr. Fine. We're going to discuss neuroprosthetics. I understand there are neuroprosthetics such as cochlear implants and retinal implants. Could you discuss those a little bit?
This is really interesting. So the cochlear implant was this amazing thing. I think it was the 1970s. They basically shove a bunch of electrodes into the cochlear canal, which is a sort of spiral. And normally in this spiral there are these hair cells, and sound waves basically cause these hair cells to bend in the cochlear. I'm not going to go into technical. And these bending causes neural signals that go to the brain. In some people who are deaf, these hair cells are missing. The electrodes replace these hair cells and directly stimulate the nerves that go to the brain. So they shove, 8 electrodes down this spiral canal, and then they stimulate the electrodes. There's no way it should work.
Yeah.
And it does, brilliantly. If you implant a cochlear implant in a child early in life, unless they're at a crowded party, they have no trouble understanding language, which is, the main thing that you care about.
Yeah.
It's incredible. And so there's been this goal to develop a visual implant. And, there's a bunch of groups right now. There's a German group. There's a group at Second Sight that I actually worked for a year, trying to develop a retinal implant. And this seems to be much harder. It's not like the cochlear implant, where really even the very early ones worked very well.
Yeah.
The retinal implants, people get some sort of visual information, but I don't think it's sort of even like the information that you get on a sort of baseball dartboard with the points of light. That's what kind of you're hoping for, and it doesn't seem to be happening.
How does the brain respond to those implants?
So one big difference, you've touched on a really key question here, which is, there you go. Cochlear implants are implanted in children who are very, very young. And so their brains are very, very plastic, and they can change to make use of this really weird information that's being provided by the cochlear implant.
Yeah.
If you implant a cochlear implant in an adult who's never had hearing, they won't get much useful hearing out of it. Adults who have had some useful hearing, they do intermediate, they do in between. But all retinal implants are actually been designed for people who've lost vision late in life, because that's the major cause of blindness nowadays in the Western world. And so these people, they're in their 50s or their 60s or their 80s, their brains are not plastic. And some of the problem may be that their brains don't have the ability to reorganize to make use of this weird information.
Yeah.
There's actually more problems than that. I think one big problem is probably that the way the retina is organized, it's not the way the retina is organized. When you stimulate the retina, you're quite likely to stimulate the axons of ganglion cells, which means that if I stimulate here, I may get a point of light that comes from a ganglion cell that represents that bit of visual space.
Yeah.
And so you end up with a very disorganized percept. And getting around problems like that are going to be key. And I'm not sure they've solved that problem yet.
What are some of the risks in neuroprosthetics?
This is really interesting. When I worked in the company, this sort of thing I found fascinating. So one is, if you're developing a device for vision or something, you really have to think about safety, use trade-offs. So in the case of a visual prosthetic, it's how much use will this provide versus the risk.
Right.
A retinal prosthetic isn't that risky. You might get an infection in the eye, you might even lose the eye, but these people are blind anyway. So it's a big deal, but it's not a huge deal.
Yeah.
But what's interesting is I think actually the cutting edge for these prosthetics is actually going to be cortical prostheses, because even though the risks of these are much higher, you can implant them in people who have spinal injuries, so they're fully paralyzed. So the benefits are huge. If you're lying in a bed and there's nothing you can do, having a prosthetic that can actually give you some ability to control the world is a massive improvement in your quality of life. And you may be prepared to take quite heavy risks in order to get that. So actually that is where some of the most interesting work is going on, because you're interfacing directly with the brain, which gives you a lot of power. And also your risk-benefit trade-off is very, very different.
Yeah.
It's kind of scary. It's very cool though.
What are your thoughts on the future of neuroprosthetics?
I think that actually prosthetics for people with spinal cord injuries are going to happen in the next 5 years, unless we develop some sort of regenerative spinal thing, and that's the best case scenario. If not, I think that will happen in 5 years. I think retinal prosthetics are at least 10 years down the line. Cochlear implants just keep getting better and better.
Thank you so much for your time today, Dr. Fine. We really appreciate it.
Thanks so much for inviting me. I've really enjoyed this.